Clinical diagnosis are important since they give the doctor a certain orientation, but they do not help the patient. The crucial thing is the story, for it alone shows the human background and the human suffering, and only at that point can the doctor's therapy begin to operate. From Memories, Dream, Reflections, Carl G. Jung. How incredible that this revolutionary mind in human consciousness shared this functional medicine viewpoint. As functional medicine doctors, we know that it is only after listening to our patients' life stories that we can even begin to try to help them. It's not really the diagnosis that matters, but more so what led up to it. This is a process that requires time, patience, and presence, and is not possible within the current medical model. As more doctors put this concept into practice, we will be able to break free from the shackles of the current medical system, practice good medicine the way we always dreamed of, decrease chronic diseases, and change the system from the ground up. And with that being read, I want to welcome you back to the 127 Fit podcast. Today's guest is the medical director and co-founder at Prime Health, is a board-certified family medicine physician and functional medicine expert. She is also a future cat mom. Today's guest is Dr. Soyona Rafatjah. Dr. Soyona, I want to welcome you to the 127 Fit podcast.
Hi, thank you so much for having me.
Yeah, absolutely. So we're going to just jump right into the warm-up. And the first question I have for you today is, how do you start your day? And is there some sort of morning routine that you like to stick to on most days?
Yeah, I mean, it kind of depends on what I have going on that day, but I do love to start my day with meditation. At least 10 minutes. If I'm really lucky, I might get 20 minutes in. But definitely meditation, and then exercise would be also ideal in the morning if I can make it happen, if I don't have my day kind of starting too early in the morning.
Okay, cool. Now, with your meditation, is that kind of like a guided, directed meditation through an app, or is that just something personal that you kind of do on your own?
It's been kind of morphing and changing over the past few years and months. Right now, I'm really into an app that Sam Harris developed called Waking Up.
Okay.
And I just find it fantastic. He's just incredibly insightful and has a really interesting way of explaining meditation and consciousness.
Absolutely.
Yeah, so that's one that I've been kind of dabbling in more so lately, but cool. Sometimes I'll just do like a free flow, just a 10-minute or 20-minute silent meditation.
Beautiful, cool. Now, in regards to exercise, if you are able to get that in the morning, is that just some sort of kind of like flow movement, or do you actually go to a gym, or what does that type of exercise in the morning look like?
It depends again on kind of time, but if I'm really lucky, I'll get to go to the gym that I belong to, Colorado Athletic Club.
Okay.
And it's awesome because I can work out there, whatever weights or aerobic exercise, and then I usually hit the sauna for like 15-20 minutes.
Perfect.
And that is exceptional. I love doing that at least a couple times a week.
Cool. Now, is there a favorite book or book that you gift often?
Yeah, so I would say, there's so many books that I love, but the one that probably changed my life the most is called A New Earth by Eckhart Tolle. Have you heard of it?
I haven't heard of that one, but I've heard of Eckhart Tolle, for sure.
That book really changed my life at the time when I really needed to read it. So I was 21 years old, just graduating college, and actually an ex-boyfriend had given it to me because he happened to be taking a class in college on meditation, which was really kind of new age back then.
Mm-hmm.
But I found it just spoke to me so well because I had never heard those concepts before. Even though I kind of grew up Catholic and like going to church and things like that.
Right.
I never really thought of it in the sense of kind of like this background consciousness that's kind of viewing all of your thoughts, and that the thoughts are incessant. You don't necessarily need to always identify with them. That was a totally new concept to me at the age of 21, and I thought, and it just really changed my life. So I love that book, and I also gift Untethered Soul a lot.
Okay, I've heard of that one. Who's the author of that one?
Michael Singer.
Okay. What's the impetus behind that book, or the kind of the gist of that book?
It's very similar.
Okay.
It's just kind of an introduction to meditation and introduction to understanding the background consciousness that's always there, and kind of just being aware of your thoughts as they're coming up.
Beautiful, cool. Now, on your Instagram, I was scrolling through just to do a little research and try to come up with some questions and stuff. I saw a couple books that you had posted on there about. One of them was called The Hidden Life of Trees, and then the other one was Essentialism, The Disciplined Pursuit of Less. So at some point in your life, because you posted them on Instagram, I'm assuming those were pretty impactful. Do you want to maybe just share a little bit about The Hidden Life of Trees and then also the book Essentialism?
Yeah, I mean, I read those in the past year, and I really like to share like little tidbits from books on my Instagram.
Absolutely.
Because I think it's hard for people to read like tons of books every year, and there's so many amazing books out there. So it's nice to kind of share like, this is like the main point kind of. And so for The Hidden Life of Trees, I mean, the main point for me was that like trees are living beings. They actually have a community. You know, there's like mother trees, and they kind of like protect their children with the shade and like allow them to grow up a little slower than they would if they didn't have that shade, so that they can, you know, be strong and everything.
Right, yeah.
I mean, it brings it back to just looking at our world and our environment as another living being that just like us.
Absolutely.
And like we are totally connected to that. And I relate that also to the disease that I see in the world happening, and the way that we're kind of destroying our environment to an extent with all the chemicals that we've introduced to the world, and it's happening to us as well.
Absolutely it is.
And I just see that parallel, and we really need to kind of nurture our world. And that's the only way that we're going to actually heal ourselves.
Absolutely.
So that was like the main thing on that. And then on the other hand, so essentialism is kind of like a totally different topic, but it's more helpful in terms of running a business. Like now that I've kind of started a business in the past several months, it's really helpful to kind of know when to say no to certain engagements, and when to, you know, focus your energy more on things that are more impactful to you. And that could be not only work, but even like personal life. Like maybe you're not putting enough of your time into your family, and that's causing you to suffer in all the other areas of your life. And actually people respect you more, you know, sometimes when you say, no, I'm sorry, I can't do that, because you're protecting yourself, and it gives them kind of, you know, permission to protect themselves too. I think that's a really important thing that we as all professionals, we really need to be thinking about that.
Yeah, absolutely. I'm reading a book called The One Thing, and kind of the gist of that book is like, you know, what is your one thing in life, and kind of like, it's okay to just focus on one thing or a couple things and just put everything into that, because I think a lot of people struggle with being like a yes man or a yes woman, and there's some sort of like maybe societal pressure or generational pressure where it's like, you know, they feel like I've got to, you know, I can't make people mad, or people get afraid of like ruffling people's feathers, and it's like they get spread too thin, and then they get kind of just like tossed to and fro by society, because they don't know who they are, they don't know what their one thing is, they don't have that disciplined pursuit of less. It's just kind of like, I gotta do everything, I gotta please everybody. It's like, if you try to live that life, like you are never gonna live your life. You're never gonna reach your full potential, because you're always trying to please everybody. You're trying to do 1,000 things at once. But I think there's a lot of power in, I know there's a lot of power in us individually knowing who we are, why we're on this earth, and pursuing that one or two things with everything that we have, and being the best that we can be individually, and doing the best that we can with what we're pursuing. And that's going to have a lot more power and impact in the world. So you kind of agree with that? Or?
Absolutely.
Okay, cool.
Yeah,
cool.
That's really well said.
Sweet. All right, so is there a favorite quote or mantra? And this could be, maybe there was something maybe when you're younger. It could be something, you know, presently. It could be a quote or mantra that's been from your younger years and carried all the way through. But is there a quote or mantra, and it could be more than one, that's really been impactful in your life?
I would say there's so many, but
yeah, I know. I'm like a quote junkie, so it'd be a hard question for me to answer, but.
But one that I actually have heard a little more on the recent side was from Rumi, and it's live life as though it's rigged in your favor. And I feel like I kind of related to that in a lot of ways because I am kind of an optimist at heart. And I feel that that's helped me so much in achieving my goals and just kind of believing in myself. And I think everyone should definitely do that. And I think that it kind of relates to what you just said in like picking the couple things that you're passionate about and just going for it.
Right.
Because if you believe in yourself, if you truly believe that life is rigged in your favor and, if you just go for it and it's going to work out, then you won't have any fear.
Right. Exactly. And that again, that's just powerful. Like I can't, this has been something recently for me. It's just like Quentin, why are you here? Like, what are you passionate about? Like, what direction are you going with your life? Because a lot of my 20s, like, I'm super free-spirited, and that can be a super good thing, or it can be a super bad thing, because on the super bad end of things, it's like you just kind of fly by the seat of your pants. There's, like, no structure. There's no discipline. There's just, like, whatever is whatever, and it's all going to work out. To a certain extent, yeah, but, like, there needs to be a focus in our lives, And, again, it's like, I've recognized and realized like there's so much power when I'm focused on why I'm here. You know what I mean? So it's just like, just whatever sets your soul on fire, whatever lights you on fire, whatever's burning inside of you, like just do it and go after it. Just live boldly and fearlessly, and not everything's going to go perfectly and not everything's going to work out, but if you just move in that direction, things will fall in place eventually, some way, somehow. Like that's what I've experienced.
I totally
agree.
And
it's again, I love that word. It's powerful because there's not enough people that know why they're here. They don't know what they're all about. They're just the hamster in the wheel. They're moving, but they're not going anywhere. So it's like, just who are you? Let's start there, and then, just go after whatever, go whatever after whatever's passion's burning inside. So
totally.
Cool. So is there a favorite or most listened to podcast? And again, if there's more than one, just share away.
Yeah, I mean, it depends on what mood I'm in, like whether I'm in like a super nerdy mood and I'm trying to learn a lot, then I would definitely go for Dr. Ruscio Radio. He's a chiropractor who is also an amazing functional medicine expert. Revolution Health Radio with Chris Kresser, also a functional medicine expert. And Ben Greenfield, who is just crazy and will do anything to himself.
Yeah, he's next level.
Research like everything to the nth degree, and I just learn a ton from him too. And then if I'm in more of a relaxed kind of state, just want to like kind of listen to something a little more interesting on my softer side, then I'll listen to like Sam Harris, Making Sense, or Christina Tippett on Being. Those are two that I really like.
Cool.
Yeah.
Now, in regards to functional medicine and everything, I'm sure you're familiar with Dr. Mark Hyman.
Absolutely.
Okay, are you enjoy him and
get
a lot from him? Okay, because I've read some of
Yeah.
his books. He's just like, I listen to him, I'm like, this guy just gets it.
So yeah, it's funny because he actually spoke at my medical school when I was a first year medical student.
All right, very good.
And he was not really that big back then. I think he wrote maybe one book back then.
Okay.
So he was kind of like getting up there.
Yeah.
But I heard him speak and I was like, oh my God, I want to do what he's doing. So I went up to him and I said, what should I do? Should I do like family medicine? Should I do, I had a couple ideas in mind and he was like, well, I did family medicine. I think you should do that. And that's what I ended up doing, honestly. I mean, I kind of like see him as one of my like kind of remote mentors.
Yeah.
I didn't like work with him one-on-one or
right.
anything.
No, that's cool because once we kind of were emailing back and forth and figuring out when we were going to podcast and stuff, and you were sharing a little bit about yourself being a functional doctor and all that, I was like, because I mean, Dr. Mark Hyman for myself, and then my mom's a huge health and nutrition nut like myself, and we've gotten so much value from Dr. Mark. I was like, I've got to ask. I wrote his name down. I was like, I'm sure that you've heard of him, so it's cool that it's even farther than just like hearing of him or listening to him on a podcast or something. You've actually talked to him, and he spoke at your school, so that's super cool because I love that guy. Like he's just, I mean, I think it's at the Cleveland Clinic.
Yes,
that's kind of where he's at, and from my understanding, that clinic is I mean, they're taking that super to the next level with the functional medicine and stuff. So
Definitely.
Very cool, very cool. All right, so Sienna, we're gonna, if you don't mind, just jump into your backstory a little bit right now. So if you don't mind, just sharing a little bit, like kind of where you grew up, kind of like what the home environment was, maybe just some of your experiences growing up, and then we'll kind of transition to maybe like junior high, high school, and then we'll just kind of move on from there.
Okay, yeah. I feel I was very fortunate to have grown up near my mom's family.
Okay.
So I have a Korean mother.
Okay.
And an Iranian or Persian father.
Okay.
So that in itself is quite unique.
Yes.
And I always kind of attribute my open-mindedness to an extent to having grown up in that kind of a household. And even like when it comes to medicine, I always say like I know there's no one size fits all approach to anyone, and kind of having grown up with parents that are so incredibly different from such different parts of the world, it's very easy for me to see that you need to approach everyone kind of individually and personalized. But yeah, so I grew up in Potomac, Maryland. It's in the DC area, and in the suburbs, pretty regular, normal childhood. I have one sister. She's older than me by about a year and 9 months. So she was kind of like my best friend growing up. Like, I really look up to her, and I still do. And we've just been very close our whole lives. And so my mom's family from Korea, they came over to the United States like maybe 35 years ago. And they all came together. So it was her parents, and 4 siblings. And they all lived in Maryland. So I was very fortunate to have like all these cousins around me, and I really appreciate having that community and that kind of family life, having grown up with that. And then in middle school, just a normal kid. I mean, nothing crazy. I was I got into sports a little bit when I was in high school, more so field hockey, lacrosse. I loved field hockey. Growing up, that was a huge passion of mine. I was really into rollerblading. I really liked like just being outside and just like rollerblading around the neighborhood with my friends. That was probably like my favorite thing to do in middle school. And then in high school, I kind of became a little bit more into studying. I had a couple friends that were, a little bit more discipline, I guess, when it came to schoolwork, and they kind of influenced me a little bit, which was great because I had various influences going on in my life. And my parents were super hardworking, and my dad always, kind of drilled into my brain that I should always go for the highest education possible. So that's kind of how I ended up, going for such high education. Because it was like, well, that's just what I'm going to do. There was really no other option. So that was a really good influence on me, I think, in the long term.
If you don't mind, I just, because of the uniqueness of your mom being Korean and then your dad Persian, if you don't mind me asking, how did they meet?
Yeah, they met in American University in English class.
Okay, cool.
Yeah, they had a mutual friend, and my mom will talk about that day like it was yesterday, and just
a great memory then, huh?
Yeah, like good. Love at first sight.
Yeah. Hey, that's
really cute.
Nothing wrong with that. So
yeah,
cool. So having kind of the uniqueness of your parents' culture and that influence and everything. I mean, you kind of talked about just having that kind of that openness to, having individualized things and like understanding just like different cultures and being open to different things and different ideas. Would you say that was kind of like the biggest takeaway from your upbringing with your family, or is there maybe another takeaway from your upbringing from your family and just that unique dynamics of that?
Yeah, I mean, there were a lot. I mean, hardworking kind of ethic. I think that was a huge part of it. Also, just generosity and kindness. I think both of my parents, and especially my dad, had always kind of just led by example in that regard. And I really do appreciate having that, having him as a role model in that sense, too.
Cool. So you said you kind of had a couple positive influences in your life once you got into high school in regards to studies, and then your mom and your dad were very encouraging in regards to reaching that highest educational status or pursuing that. So was that did you really kind of catch a bug for studying and stuff in high school? And then just kind of what did that look like? Because sometimes, for me, it was like, I played sports, get my 3.2 GPA, do whatever I got to do, graduate, go off to college. But did you really, was there kind of a turning point? Maybe it was the influence of those couple friends, but was there a turning point where you just kind of dove into the books and just kind of went after it? Or did that kind of happen after high school? What did that kind of look like?
I mean, my passion for learning was more so after high school, I have to say.
Yeah.
I think it was maybe because I just didn't really have much direction in high school. I didn't really know what my passion necessarily was.
Right.
I was interested in science and things like that, but I wasn't so sure of myself in being able to achieve like a degree in that. So actually, when I went to college at University of Michigan, I started out in the liberal arts school, and I was thinking maybe I would do like graphic design or something, computer science, like something a little bit more like on the artistic side, because I definitely do have an artistic side, but then I realized like science was actually really interesting to me. I really liked math. I ended up in the engineering school, and I did biomedical engineering, and that kind of made me kind of have confidence in myself in being able to study science and physiology and biology and things like that. And that's really where I started to get really interested in like the human body and actually how it relates to humans. And that's where I kind of parted from the engineering world because I wasn't as interested in working with machines. So I actually took a year off between medical school and undergrad, applying to medical schools and things like that. And I worked with severely mentally ill people back in Maryland, lived with my parents for that year. And that showed me how much medicine was not a holistic treatment. I realized that, you know, these people with schizophrenia and bipolar disorder and hallucinations, you know, their symptoms were being controlled with medication, quote unquote, but then they had all these side effects, like they were fatigued and they were kind of out of it, and a lot of them were gaining substantial amounts of weight and getting high blood pressure and diabetes because of their medications. And I realized that their doctors really were not involved in any of that. They were just kind of like, let's give a medication to control this one tiny aspect of you and not, you know, ignore the rest, kind of. So I decided at that point, like, I really wanted to practice in a different way. And I made sure that I went to a medical school that had an integrative medicine department. And so that's how I ended up at University of Miami in Florida. But yeah, so that's really where I think I started to find my passion. Like I started to see these kind of gaps in the healthcare world, and I saw how things like nutrition and meditation and exercise and you know, supplementing people with certain things that they were lacking, like that was so powerful, and it actually gave the body things that it needed to perform in an optimal way, as opposed to blocking actions from occurring with medications. Like that's really where I started to develop more of my passion and more, I guess, motivation to like read and study on my own.
So I want to, before we dive too deep into that direction, I just want to take a step back, and if I remember right, before we turned on the podcast, you had mentioned about maybe growing up in some sort of like Catholic religion or something like that, because I feel like, you know, where you're at today and just like the holistic approach and everything that you have going on medically right now, like that spiritual side of things is a integral important part of all of this too. So just to kind of give a context for myself and the listeners, just if you don't mind, touch on a little bit of maybe some of that, the religion or more of the spirituality stuff that you grew up in as a kid, and then and just kind of where that went for you as you went through high school and as you got a little bit older, and then we'll kind of pick things back up with the college and stuff, if you don't mind touching on that.
Yeah, absolutely. It's really interesting how I've kind of, you know, my path has kind of changed a lot in terms of spirituality. I grew up with religion when I was little, like, because my mom was always going to Catholic church every Sunday. So I went to church every Sunday with her. I did CCD classes. I, you know, did my confirmation when I was a teenager, and I was super, you know, in the Catholic world growing up. And then as soon as I left for college, I completely kind of abandoned it. Actually, I didn't, maybe I went to church like a couple times a year after that. And I didn't really, I guess, identify as much with Catholicism because of kind of the political views and things like that. I had a little bit of like dissonance about that. But then, like I said, at the end of college, I kind of found meditation in a more like, Eckhart Tolle, he kind of talks about actually Christianity a little bit, Buddhism. He's not super religious, like per se, and denominational. So I really I really did identify with that more so, and just general spirituality. And that's kind of how I still am now today, like many years later. I would say, like, even, I mean, among myself, like, I need spirituality and just belief in something greater than us. And, having that is so powerful to me, and just like reminding myself every morning through meditation and everything, like, that really does drive me to be the best person I can, and just, shine a light on the world wherever I can.
Absolutely.
So I feel like also in my patients, I see the ones that have some form of spirituality or have some form of, belief in something greater, some type of purpose, like they do so much better overall. And I think it's such an important part of health.
Absolutely. And that's why I want to take that step back and have you just share a little bit about your personal experience with religion or spirituality, whatever word you want to tag on there. But I mean, even part of your starting your day and your morning routine was that meditation, kind of that quietness and stillness and things like that. I mean, and I think this is an area that a lot of people within health and fitness neglect. I think the door is opening more and more, but still very neglected, because if you look at the whole human being, we got the mind, we got the body, and the spirit. The body has been focused on, I think, for generations and generations, and there's a lot more focus now currently on mindset and all of that. I'm starting to hear a lot more, which is great, but I still think there's a lot to come in regards to that spirituality and that understanding of kind of like what that is, and taking care of our spirit, because I firmly believe that if we just focus on the body and the brain and not the spirit, then as a human being, we are never going to be able to reach our full potential. If I just focus on the spirit and the brain, or if there's just a focus on one or two, but not all three, again, we will never reach our full potential as a human being. So, and I really feel like just kind of where you're at with your practice and everything, you have a great understanding of there's that mind, there's the body, and the spirit, and we have to take all of that into account when we are dealing with people's health, but also when we're dealing with ourselves and trying to be the best version of ourselves and reach our full potential. So I appreciate you touching on that a little bit, because I think that's really important in kind of where we're heading today.
Yeah. And what's amazing is that there's actually science to kind of back up.
Absolutely.
To what you're saying, because a couple books I've read recently, one called The Biology of Belief by Bruce Lipton. He was actually also featured a ton in the recent documentary that came out on Netflix called Heal.
Okay.
And it's all about like mindset and belief and spirituality, and like how that actually affects you on a cellular level.
Absolutely.
It's really incredible. And he's been studying this stuff since like the 70s. So it's not like new information. It's just, I think more people are kind of like recognizing it. And then another great person who's been very vocal about this is Joe Dispenza.
Okay, yep, I've heard of him, yeah.
Yeah, and Gabor Mate. They're all, really amazing scientists that have just really put the science behind the belief systems and the spirituality.
Cool. Awesome. Well, thank you for sharing that, because it's something that some people aren't always comfortable talking about, but I think it's needed to be talked about more, you know what I mean? Especially when we're talking about holistic health. So, all right, so we started kind of unfolding kind of the college experience. So just so I'm on the same page with you, your undergraduate was at the University of Michigan. Is that correct?
That's right,
okay,
yeah.
So then after what was your degree did you get at University of Michigan again?
Biomedical engineering.
Okay, that's like next level. I don't even understand that. But so then after that, you took a year off. Is that correct? Okay, and then you worked with the patients with the different mental illnesses and struggles and stuff. So that was like an eye-opening experience, right, for you, and just kind of like learning like, hey, there's more to this whole medical thing and health thing than medication, right? And kind of the way it's always been done. And then you ended up going to medical school at the University of Miami in Florida. Is that correct? Okay, so let's just unpack a little bit of that experience of medical school, because that's like, that is on a whole different level. That's like, in regards to focus and discipline, in regards to studying and all of that stuff. So just share your experience at the University of Miami and kind of like some of the stuff that you really started to learn and take from that experience.
Yeah, I mean, there was a lot. There was a lot. And what's really interesting is that, like I kind of said, I kind of like found myself a little bit at the end of college, I think, with reading that book and understanding my mind a little bit better on a deeper level. I went to Europe with a friend of mine, my best friend, and we traveled around for a couple months,
Cool.
and that also kind of helped me see the world and like took me out of my shell a little bit. And then going into medical school, I really kind of felt a little bit more myself, I think, than I did when I was younger, kind of like knowing myself a little bit more. And then also I guess the confidence of having gotten into medical school and being around these people that are so highly intelligent and I respected so much. That really helped my confidence, I think,
Absolutely.
in ways that I didn't really have before. And I just met really amazing people, made really great friends, and being in Miami, Florida, I think was a blessing for me. I really chose that location.
Yeah, that's better than Michigan. I lived in Michigan. That's
Oh yeah.
yeah.
Yeah, I mean, Michigan was great, it was fine, but it was cold and
Weather-wise, Miami's a lot better, right?
Yeah, I really needed that change.
Cool,
and
cool.
Spent a lot of time on the beach, a lot of time having fun, actually. Like, I think I studied maybe too much in undergrad.
Yeah.
And I probably had more fun in medical school than I did in college.
Yeah.
So that was really good for me, too, kind of just, like, letting loose. But, like I said, kind of going into it, I already knew I wanted to practice an integrative medicine kind of way. So it was a little hard for me to kind of go through the motions and, okay, so we're going to treat this person with just medications, and we're going to give them, acid blocking medications for their reflux, and we're not going to talk about diet, and, like those kinds of things were extremely frustrating to me. But it's okay, I knew I had to get through it. I knew I had to get the MD and be a credible person so that I could then kind of bring in the other things with credibility and with this kind of background knowledge. So while I was in even residency, I went really deep into learning functional medicine and clinical nutrition. And, I was really fortunate. I had an amazing mentor in Miami named Janet Kunefal, and she ran the integrative medicine department there as a clinical psychologist and acupuncturist. So she brought functional medicine programs down. She's the one that brought Mark Hyman down.
Cool.
She's the one that brought David Perlmutter and Bob Roundtree and all these amazing names in functional medicine were lecturing to me in University of Miami because of this woman and the programs that she created, along with this other mentor of mine, David Bleiweiss. He was also highly involved in that program. So I was able to graduate residency with kind of this double background in functional medicine and regular family medicine. I'm super grateful for that, for having been in that situation and taken advantage of it. But at the same time, I do have to say, like, it was a lot. I was working a lot, and I was also on the weekends going to these functional medicine courses. So it was kind of a recipe for burnout to an extent, and I was kind of going out too and having fun as well, because I needed that kind of balance.
Yeah, and you're in Miami, so it's kind of hard not to do that, right? I mean,
yeah, exactly. I mean, and it was there and it was enjoyable, but I was burnt out. Toward the end, I did an adrenal function test on myself, and I was totally flatlined, actually. And I was like, wow, like I knew I was feeling a little tired, and I was relying on caffeine at that time. But seeing that flatline was really eye-opening. And it made me realize, wow, like I really need to actually have more balance in my life.
Okay. So we're at now you said something about in high school, I think you kind of picked up sports a little bit, you know what I mean? Like, and I think, was it field hockey you said you kind of gained a little passion for at that time? So you had, and was that kind of was junior high school around that time frame? Was that kind of the first exposure you had to maybe organized sports and just kind of exercise and type stuff like that? Or was that something that was maybe shown to you when you were younger? Or
actually, I did play soccer when I was in middle school.
Okay.
And then also in middle school, I played basketball at the church.
Okay, yeah.
So those were kind of my more introductions, I would say.
So through high school and sports, but then kind of touching on more college and around that age and stuff like that, did you kind of keep some sort of exercise in your life, or did you just kind of completely dive into the academics and just not really have any of that type of movement or physicality in your life?
I kind of did, actually.
Okay.
Yeah, it was a little more peripheral. Like, I
Mm-hmm.
didn't really understand health back then the
Yeah,
way I do
yeah,
now.
right.
But I definitely knew that I felt good when I did things like rollerblades. So I
Right,
would,
yeah.
I would go out and do that, and there was a gym on campus
Yeah.
in Michigan, of course.
Mm-hmm.
And my roommates, actually, that I lived with, would go to the gym. And
Oh,
so
cool, okay.
it was kind of like a social thing. Like, we
Yeah.
would just go to the gym, and that's just, it was something that we did to stay fit, and I enjoyed it. And then I think after college, when I was in that year off, that was when I got a little more into running, like
Okay.
running outside.
Yeah.
It's usually because of like influential people in my life, like friends or boyfriends or someone
Mm-hmm.
that, at that time, I think I was dating someone who was running track or
Yeah.
like, long distance running. So then I got into running a little bit more. And then,
Yeah.
and then I kind of got into yoga actually at that time too,
Right.
which I think was a huge blessing for me as well, and continued through med school and residency, running, yoga,
Okay.
some weight training.
Mm-hmm.
And that's pretty much what I still do right now.
Cool. So I wanna go back to, you just talked about having kind of that adrenal fatigue and taking that test and things of that nature, and you said you realized you needed more balance in your life. So I know personally for myself and some of my life experiences that we people that are kind of type A, very driven, very focused, going after what they want to go after, it's really easy for us to kind of get sucked into that. And even people, sometimes people that are personal trainers or kind of in health and fitness can be some of the most, it's just straight up most unhealthy people.
Mm-hmm.
I've competed in bodybuilding, and sometimes those type of physique competitors, male and female, are some of the most, they look the freakiest and they look the best on the outside, but sometimes we can be the most unhealthy on the inside. Mm-hmm. So what I'm trying to say is that even us people that are focused on health and fitness and teaching and preaching all that type of stuff, if we aren't taking care of ourselves and really being that example, then what we're sharing and what we're trying to teach and impact the world with isn't going to be very powerful.
Yes.
And we are going to end up kind of like what you said there just a minute ago, kind of burned out and just kind of like whoa, what's going on here? So just talk about Soyona a little bit, the importance of us as human beings taking care of ourselves first and focusing on ourselves first and having a full cup so that we can pour into other people's lives and impact powerfully other people's lives.
Yeah, absolutely. It's so huge. And I think having lived in New York City for 4 years too, I saw a lot of this as well, which is actually part of the reason why I moved to Denver. But yeah, I think it comes from a balance that we need to achieve between, like you said, the type A kind of like achievement driven type personality, and balance that with the self-love, the self-compassion, and like the softer side of things. Because if there's too much on one side or the other, either you're not getting stuff done because you're just not doing anything, or you're just not taking care of yourself. It is like you do have to constantly check in with yourself. Like, am I doing what's best for myself? How can I be more loving to myself today? And that's really where your ability to love other people and give part of yourself to the rest of society comes from. If you don't have that self-care and self-love and compassion for yourself, then there's no way that you can have that for other people. So and I have seen that firsthand, with myself for sure, and I've been through parts of my life where working too hard, for whatever reason, maybe saying yes to too many things, or allowing other people to manipulate me, maybe for my skills or whatever, and then not having the compassion for other people anymore. And then it's like, well, who's winning here? Like, no one, So yeah, it's really about, and that's kind of what I'm trying to do out here right now, is just finding that balance between the two aspects of myself.
So for you personally, how do you kind of check in with yourself? Like if you kind of recognize like, hey, like I'm unbalanced right now and I've got to take a step back. And you mentioned like living in New York City, which I've been there. My aunt lived there for years, and that's just like a bunch of type A people just go 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 go.
Yeah.
But so how do you like New York, and then you moved out here kind of just maybe to slow some things down and maybe gather yourself, but how do you check in with yourself, and how do you recognize when there is that unbalance in your life?
Yeah. So I've come to a realization that it's actually something extremely simple, and it's just a question that I have to ask myself is, am I having fun?
Cool. Simplicity is good. I like that.
Yeah. And I've shared that with some people too, and I did not come up with that. Actually, one of my mentors that lives in New Jersey, he's amazing, asked me the same question, when I was kind of starting my business, and I think that that's so profound. I mean, what are we here for? Are we here to create suffering for ourselves?
Right.
Like, why would we do that? But I mean, yes, you want to be motivated and you want to be creating something and doing good for the world and society. Right. But if you're not having fun doing it, then what is the point? You're hurting yourself, and you're probably not so much fun to be around, actually, for other people.
Yeah, so, I love it. It's great.
So there's just either, if you're not having fun, then it's either your frame of mind needs to change, so the way you're thinking about your situation needs to change, or the situation itself has to change. And you got to go through steps to make that happen.
Yeah. That's good. Man, I like that. Am I having fun? That's good. That's a great question. Again, it's simple, and that's good. So, all right. So you finished up medical school at the University of Miami. What happened next?
So after Miami, that's when I went to New York City.
Okay.
Yeah, I was in a previous relationship back then. I got a job that was, to me, my dream job at the moment, which was amazing. I was starting to work at this place called the Center for Health and Healing, associated with Beth Israel Hospital.
Okay.
So it was like the largest integrative center associated with an academic hospital, which was pretty awesome because it had that kind of academic backing, but we were also working amongst so many different practitioners like chiropractors, physical therapists, acupuncturists. We had all types of doctors, cardiology, dermatology, internal medicine, family medicine, podiatry. I mean, it was literally like 2 floors of amazing humans, and I was so grateful to work there. Unfortunately, there was some financial things that happened where Mount Sinai merged with Beth Israel, the 2 hospital systems.
Okay.
And unfortunately, I guess they weren't making enough money to be able to sustain themselves, so they had to close their doors. So I was working there for almost 2 years when they closed their doors, and it was a gift and a curse. I mean, I thought of it as something bad at the moment, like, oh wow, now I have to figure out what I'm going to do next. But in the end, it really was a blessing because it made me seek out other opportunities, and they ended up being so much better for me in the end. Because at the Center for Health and Healing, it was still an insurance model. So we were working with patients taking insurance, and I was trying to practice integratively and, functional medicine,
right,
doing a deep dive into lab tests and prescribing various, supplements and natural medicine protocols and lifestyle counseling and things like that. And it's really hard to do that in 15 minutes, So I was kind of burning myself out in that regard. So it was a nice transition for me out of kind of the insurance model.
Yeah.
So then I was able to work in practices that were more cash pay, but you were actually allowed to have the time with your patients to make a bigger impact in their lives.
Okay, cool. So I wanna start talking a little bit about what functional medicine is. Now, probably a lot of the 127 Fit podcast audience has a pretty good grasp and understanding of that, but we might have some people that just really don't understand that or have really any clue what that is. So just simplistically, Soyona, can you just kind of explain what functional medicine is and kind of what that entails for somebody that might not have that big of a grasp of what it is?
Yeah, definitely. So The definition is really using systems biology in order to address the root cause of an illness as
Okay.
opposed to covering up symptoms. So basically what that means is using systems biology, meaning knowing that the whole body is connected,
Right.
knowing that every organ system is connected to one another, then doing a deep dive into looking into why this dysfunction is happening in the body. Not necessarily using a medication to block something from happening, but
Right.
but looking at gut health, looking at nutrition and food sensitivities, looking at toxicities in the body, looking at the hormones and the adrenal function, all these things connected together, and how that creates health.
Cool. So how does that compare then to, so you're a medical doctor, like when you went to the University of Miami, like you went through kind of the normal medical doctor classes and all of that stuff, to just like if we were to go to like a hospital here in Denver, you walk into the ER and you see a doctor, like that's you, right? I mean, like you've had that experience of kind of like a normal, not an ER doctor, but you've had the experience and the education. You are a board certified family medicine physician. So you've had that kind of the normal American doctor experience, but then you also are focused on the functional medicine. You're an expert in that, and you've studied that. So with the definition that you just gave in regards to what is functional medicine and the kind of that functional medical practice, how is that different from kind of the normal average walking to the hospital doctor visit? Just for the people out there that don't really know. I mean, I know, and I'm super passionate about it. So, because when you reached out to me and said, "Hey, love to be on the podcast," I'm like, "Hey, like you don't have this is awesome," because my mom, like I'm originally from Iowa. My mom still lives in the town where I grew up, a town of 5,000 people. She had to drive 2 hours to a different state to meet a functional doctor and to get some stuff that she needed to get, kind of some blood tests and all that stuff. She had to drive 2 hours to South Dakota from Iowa to meet up with a functional doctor. Wow. It's becoming more of a common thing, but still, I mean, it's just like the like Dr. Hyman talks about, like these food deserts and stuff. I mean, in Denver and Colorado, dude, we've got it good here. Southern California, there's areas where we have all this stuff, very progressive. We have these doctors and have access to it, but there's still a lot of places in the United States, whether it's food or holistic medication, holistic medical doctors, where they don't have it, or they got to drive to a different state. So just share with the listeners that maybe don't understand the difference between the functional doctor and that type of practice, and then like the normal doctor they go see at their local hospital.
For sure, yeah. I think the main difference is that when you're in medical school, still now, back when I was in medical school, also the same thing, you're basically taught to diagnose someone with whatever disease, right? And then once you get the diagnosis, that's associated with treating with some type of medication. If it's beyond your scope of practice, maybe you'll refer them out to a specialist and they'll kind of do further workup and prescribe some other medication. But it's very much heavily around using medication. It's not about looking at, okay, why is this happening?
Right.
I'll give an example. I treat a lot of people with hypothyroidism, for instance, where the thyroid gland, which is the metabolic center of our body, stops functioning so well. And usually, doctors will wait till that thyroid number gets so dysfunctional that they will be like, okay, now you need a medication. Okay, and that's it. And it's just medication, and that's the end of the story. But when you're looking at it from a functional medicine perspective, there's so many questions that come in, just like the quote that you read, before we started, is that the diagnosis is the beginning. And then now we ask, okay, why is this happening? Do you have, Hashimoto's? Is it an autoimmune process? So check those numbers. Those are things that most conventional doctors don't even do, is look into why is your thyroid not functioning right? Or maybe it's an adrenal issue that's causing the thyroid not to work well. And then look further, okay, if it's an adrenal issue, what's your lifestyle? Let's talk about it. Let's talk about what is your day like? How have you been living for the past 40 years? And what's led up to this point? And if you do have an autoimmune disease, then let's look at your gut then. Let's look at your gut function, because 80% of your immune system is produced in your gut.
Absolutely.
So that's absolutely needs to be addressed. And then what kinds of foods are you eating? Because that's obviously correlating to gut health as well. Let's look at any toxicities that you might be exposed to, because if your body's toxic, then your immune system's going to go crazy. So there's so many questions that can be asked, that can be delved into so much further than the conventional model does at the current moment. And it's really unfortunate that this type of medicine is not available to everyone. But I mean, it's definitely building a lot of momentum. I in the past 10 years that I've been studying this way, I mean, I've seen huge blow up of people that are interested in this type of medicine, from practitioners to patients to everyone. So I mean, it's definitely coming. It's definitely, it's there, but it's probably going to be, at least a decade until this is like a little more mainstream.
So from just my understanding, like the normal medical practice compared to the functional medicine practice, the kind of the normal medical practice and the way the doctors and everybody in that setting kind of looks at things is basically they see a symptom or whatever, or there's an issue, and basically they just kind of put a Band-Aid over it, right?
That's right.
As opposed to looking at what is actually what's the inner cause, or what's kind of the next deep level of what's this issue or causing this. They just say, okay, here's the symptom or here's the issue. We're going to basically give you this medication. We're going to put a Band-Aid over it, and you should be good to go. But with the functional side of things, you kind of take a step back and say, okay, here's the symptom or here's kind of the issue in this area. Because everything's connected within the body, from top to bottom, we're gonna take a step back, and we're gonna look at this whole person. We're gonna look at the whole body and see what other areas are really actually causing this symptom and this issue. Is that fair to say it that way?
Absolutely.
Okay.
And the reason why, I think a huge reason why this has happened to our medical system is because, I mean, when it comes to acute care, right? Like, you end up in an emergency room, you're having a heart attack, like, you want that medication.
Absolutely. Right.
Take the medication, take the procedure, your life is saved now,
right.
And it's very understood that way. Medicine works when we need it.
Yes.
And I'm not saying I'm not anti-medicine at all. I prescribe things all the time.
Absolutely. Yeah.
But for chronic diseases, for things that are like active dysfunction in the body that are just progressively going to get worse and worse, chronic medication use is not helping the problem at all.
Right.
So that's the huge difference between the way that conventional medicine treats acute versus chronic disease, and where we're lacking so sorely in the chronic disease department.
And the medication that is being given to people it may be treating that symptom and maybe that specific issue, but it's causing tons and tons of other issues within the body.
Absolutely.
It's a compounding effect. Like, I mean, my mom goes to the local doctor at the hospital in our hometown in Iowa, and it's like she's got higher blood pressure, which it's a hereditary thing and all this, and they're gonna throw medication at her. And my mom, she's never been to college, but when she gets on something to study it, like she takes care of business. Like, she's just amazing at, like, hey, there's this, I don't really know about it, I'm gonna go study, I'm gonna find out information. She does a great job, and she's like that self advocate and just does a really great job with all that. But they want to give her this medication. My mom takes a step back and says, absolutely not. She's like, she goes and studies and like, okay, here's some maybe some home remedies, here's some supplements, here's some foods, and then she goes back, takes care of that, goes back, and then her blood pressure is dropped, whatever. And it's just like, because she knows if she takes that medication, like, yeah, it might help lower her blood pressure, but it's going to cause all these other issues with her.
For
and
sure.
That's what we see in our country, right? Like, again, like, I have no issue with, a doctor, if I get in a car accident and have a, broken arm, like, yeah, take me to the ER. Like our country and our doctors, our medical system is amazing at, like, the emergencies and all that, the cancers and stuff like that. But, like, giving somebody the medication and, like you said, with just kind of like maybe some of the smaller symptoms or whatever issues, it's like giving that medication, like, that's like the easy way. And then we can get into the whole thing where it's like, the money that's involved, like, it's all goes back to money. We all know that, or you should know that. But anyways, they give the medication, but then we have all these other things that are going on, and then people go back and like, well, yeah, my blood pressure or my cholesterol, whatever, is lower, but now I can't sleep, or I can't, I'm dizzy and all this. So just touch on that a little bit and explain to the listener where it's like, hey, they've been taking this, heart medication for 20 years, but then they've realized, in that time they've had like 20 other issues.
For sure.
And probably a lot of that, if you got off that medication and took things at that holistic approach medically, like you probably have all those issues gone.
Yeah.
The one that you're taking the medication for and the 20 other ones that popped up over the 20 years that you were taking, right? Like,
Absolutely.
So just share that a little bit
Yeah.
in regards more medically and not my PE teacher slang or whatever.
No, that's great. I mean, thanks for sharing your story about your mom. My God. Like,
yeah, she's
I really
hardcore.
respect people that take it into their own hands, and I really like working with people like that are so driven,
Yeah.
But yeah, I mean, honestly, it reminds me of a patient that I saw just on Friday. 76 years old, his wife thought that he was having a little bit of cognitive decline, maybe a little memory loss. So she's a patient of mine, and now he is as well.
Right.
And so I saw him, and I looked at his medication list, and there's actually 2 medications that he's taking every day that could actually be contributing to memory loss.
Yeah.
So, he's taking like Advil PM, for instance, and the PM part means there's Benadryl or diphenhydramine in there, and that has been, chronic use of Benadryl has been associated with cognitive issues down the line. So that was a big red flag for me. And then the other thing was he's been taking a statin also for maybe a decade, and that's also been associated with memory loss. And I'm not trying to take him off a statin. I know he has a history of heart disease in the family, and he is on some blood pressure meds, and he's got some stuff going on, and he definitely will change his lifestyle in some ways that will hopefully help a lot. But specifically, he's on simvastatin, which is a lipophilic, meaning it's deposited in fat, it's dissolved into fat, statin medication. And those are even more associated with memory loss because the brain is majority fat. So I immediately changed him to a non-lipophilic Crestor, a statin that's not lipophilic, and hopefully that will help a ton, and we'll monitor his levels of his, cholesterol and make sure that that's all good. But just, simple things like that his doctor clearly wasn't looking at, even though they put him on a medication for memory loss, which is, there's terrible data on it. It really doesn't work. It actually gave him gastrointestinal symptoms and made him tired. So after a few weeks, he just stopped it. Yeah. But that's all they did for him, coming in with memory loss. And there's just so many other things that you can do for memory loss. Sauna, low glycemic diet, more like ketogenic diet, maximizing his sleep.
Movement, right? Just walk, right?
Exercise is one of the best ways to prevent memory loss.
Right.
So many things, and so it is astounding to see, the use of medication and the lack of kind of like holistic view on people. But that's where my passion comes in, and being the change that I want to see. Absolutely. So there's a lot of room for that.
and I believe too, as human beings, as people in our society and culture in the United States of America, there's a lot of laziness, and so people that are super passionate about fitness, health, and this whole holistic approach to life and longevity and wellness and stuff. And this is a frustration that myself and my mom share, and we talk about all the time. It's like we can stand and we can live it, share it, teach it, preach it, like whatever. But unless people are willing to put forth that effort and are willing to change and to try something different and new, nothing's going to happen. And I really think because of the laziness in our culture, and because it's a lot easier just to walk in, get some pills and pop them and go home, like that's kind of playing into that whole culture of, hey, like here's the medication and the doctor said it, so it's the gospel, and I'm going to go home, pop the pills, and we're good. Right. In a sense of like, it's very easy. Yes. Like it's hard. Like my mom, like she puts in a lot of time and effort and energy, money to drive 2 hours to a different state to do all this. but she understands the power of kind of that holistic approach and food and exercise and all that. But a lot of people are uneducated in that. And I think, honestly, Soyona, a lot of people are just unwilling to put forth that effort and the energy and the time into themselves to not have to take the medication, because it's a lot easier just to kind of pay the money and get the medication and go on with your life. Even though they don't realize, like, investing in yourself right now and spending a little bit more money on the food and the supplements and all that stuff, that's going to probably give you a longer, more fulfilling, powerful life, but it's a lot harder, to be truthful. So that's kind of, I think that's really playing into kind of this whole, here's the medicine, just go on with life type of thing. I'm not blaming the doctors. I think there's a lot of room to improve with the medical system, the way it's set up in our country. And I think, some of the doctors need to kind of realize, like, yeah, it's nice to make money, but, like, why are you actually a doctor? Like, shouldn't you be, like, invested and interested in improving people's lives? You know what I mean? And really just, like, opening up themselves. But I think also, like, the patients and us people like myself on the outside, it's like, you have to be willing to put in the work, and it's not easy. It's not easy to have the routine of exercising and taking different supplements, and it's going to cost a little bit more money now and all of that, but it's worth it. It's really worth
absolutely.
it.
I mean, we definitely think so.
Right? Yeah.
I mean. Yeah.
But I mean, do you kind of see where I'm coming from? Those just like I don't care what anybody says. Like I just straight shoot. Like there's a pervasiveness of laziness and just kind of like easiness in our culture. I see it from kids as a teacher all the way up to adults, and I really feel like that's feeding into like people just kind of going with the flow and just like, yep, I'll take the medication. It's easy, or I'm gonna go to the chiropractor, get popped, and just keep going on. It's like, well, but you can actually probably help yourself out a lot by just maybe moving a little bit more, stretching, having that mindfulness practice, and just putting in a little bit of effort, and that'll go a long way. So
for sure. I mean, I think it probably comes back to self-love and like believing in yourself too. Yes. Because it's those perpetual negative thinking thoughts that make you lazy. Like, whatever, like I can't, get better anyway. I can't, I've never been in a gym before.
Right,
that's not me. And, those types of thinking. So it's about kind of like giving people hope, motivation, trying to get the word out that, this is not your destiny. You are in control. Yeah. Beautiful.
Yeah. Okay. So we've already been going for over an hour, which is crazy because I feel like we're just getting started, but a few more things here. Now, you are the medical director and co-founder at Prime Health. So I want to give you an opportunity to kind of share about, your practice that you have here in downtown Denver and kind of what that means to you and what that looks like if somebody wants to get connected with you, Soyona, and learn more. Like what is Prime Health and what are you guys all about?
Yeah, so we started Prime Health a few months ago.
Okay.
Came out here from New York City, basically building our dream practice.
Perfect.
And that's really what it's becoming, which is really exciting. And we've got a lot of amazing patients joining, and it's really, really awesome. So there's a couple of different things that we do. One is concierge primary care. So meaning you join as a member, and I'm basically your doctor on call. If you need anything, you can come in for a visit. You can call me on the phone. Kind of like that high-end, high-attention care with all obviously functional medicine and integrative medicine in there. And then we also have disease reversal programs specifically for hypothyroidism, IBS or irritable bowel syndrome, and type 2 diabetes.
Okay.
So because conventional medicine is so kind of poor at addressing, so many things, but it's definitely those three conditions. It's just pills. It's just, this is a progressive disease. I'm sorry, you're just going to get worse and worse. It's definitely not the truth. You can reverse these conditions or at least halt them to the point where they're not progressing. We can look into the root cause and address the root cause. So those are the three disease reversal programs, and we'll usually have them be between 6 or 9 months, depending on the situation. And that's kind of what we offer right now. I'm obviously the medical doctor that's the sole practitioner right now, but we also work with an amazing health coach, Katie, and she actually used to work in a functional medicine practice in New York City with me. And so it's so it's a team effort, and it's been really good. We have a lot of great people joining, and
Cool.
we're definitely ready for more.
Yeah. So if somebody contacts Prime Health, you are the primary doctor. You're
Right.
you're the one that they're going to be working with at this time in the game, right?
Yes.
Okay.
Yeah.
Okay. Cool. Now for me personally, like in Colorado Springs where I live, I've gone to a functional doctor to just kind of get some like food sensitivity testing done because I've had different issues with my gut and all that. Unfortunately, I didn't have a very good experience because the whatever time frame we had, like 45 minutes, she didn't get all the testing done. She didn't say, come back later, and then she tried to sell me all this supplements and stuff,
Wow.
and it was just it was a poor experience. I left there pretty frustrated. You know what I mean?
It's a bummer.
But yeah, it is because it wasn't cheap. But anyways, so I've had that kind of experience. So, but if somebody is interested in the functional medicine and they're like, man, like I didn't really know about this, they're a listener and they're like, I want to find out more about this. I really am interested in Dr. Soyona and all of that. Do they just call like Prime Health and kind of what would a process look like? So somebody like myself wanting to get in touch with you to get kind of some things checked out. What does that process look like? Is it just calling, talking to you, or the secretary? What does that look like?
So we have a link on our website on primehealthdenver.com.
Perfect. Okay.
You can inquire there
Okay.
and just ask for a consultation, and we do free consultations.
Okay.
So I'll meet you here in my office for 30, 45 minutes,
Yep.
whatever, to talk to you about your needs, how I operate, and how we could work together.
Okay.
If it's a good fit, then we'll figure out how to
Yeah.
move forward.
Okay, cool.
Yeah.
I just want to make sure that all that information is clear for the listener because I'm sure there's some people that would like to get connected with you, and
Yeah.
once the podcast is on the internet, it's on there forever. So it might be 5 years down the road, you're in some, I don't know, your own building somewhere in Denver, and be like, hey, I gotta check this person out. So very cool. Now, I want to talk about just the power of. So I want to, because, so I've got 1, 2, 3, 4 things written down. The power of food, sleep, movement, and intimacy/connection. And I want to just focus on, just for time's sake, intimacy and connection, because that's something I'm really starting to hear as I continue to learn and listen to a lot of podcasts and dive deep into advancing my knowledge and understanding of health and what all that means holistically. I'm starting to hear like the importance and the power in regards to our health and longevity and wellness in regards to like connection, community, intimacy. And from what I've heard, some of the studies are showing like maybe, if not for sure 100%, the most important thing to our health and wellness and longevity is that intimate connection with other human beings.
Yes.
So would you just share kind of your perspective and your knowledge on the power of and the importance and the value of intimacy, connection, community with other human beings and maybe even like having a significant other in your life and what that kind of looks like?
Yeah, definitely. I mean, there definitely is research coming out on
Right.
that. I don't remember the exact statistic. I think it was that connection in your life is a more powerful indicator of health
Right.
than I think it was exercise, smoking, and alcohol. Not sure exactly which factors they were testing against,
Right.
but I think that was it. It's pretty profound. And then when you look at like the blue zone studies,
Yep.
the places where there's the most centenarians in the world, across the board, community, connection, family, they're all, all those communities have high scores
Right.
in those areas. So, I mean, I think it's absolutely important. I mean, and we can see kind of with the health of our world, the chronic disease on the rise and our health kind of declining here in the modern world. I mean, we're like working in these little offices, cubicles, lacking connection, and then going back to our little, box apartments,
Right,
not
yep.
living in a community, like probably living hundreds of miles away from our families. And I mean, there's definitely something to be said to that.
Right,
and
right.
There's a lot of people trying to change that by creating like commune type living situations. And I think that that's really, really interesting. I think that will probably be done more and more, and even just amongst friends, I think. But yeah, I mean, there's there's a lot of really cool communities being built. Like there's one called Archipelago that I recently joined here in Denver. That's just a community for kind of friends, for people sharing and
Cool.
yeah, like human experience.
Right,
you know,
right.
so many different activities that you can do. But I mean, just doing that alone, I think has kind of helped my well-being to an extent in a new city. And so, yeah, I just think that there's a huge impact that, you know, community and intimacy
Right.
plays
Cool.
in people's health. Yeah.
Very good. So, why Denver? Why did you move from? I mean, a lot of my guests, the guy I actually interviewed earlier this morning, he's a native to Colorado, but I'd say probably 90% of my guests have moved out to Colorado. So for you, and you know, it's interesting kind of hear why Denver, why Colorado, what have you. But for you from New York City, why Denver, and kind of what was the process that you went through to kind of find Denver? Because it's kind of a long ways from
It is.
let me see, Maryland, Florida, New York, Michigan. So
It's true. I mean, yeah, I really did feel a calling
Cool.
out here. The mountains. I am a snowboarder and I
Okay.
love that. I love hiking. I love the outdoors. And honestly, living in New York for the past 4 years, I really have felt a little claustrophobic.
yeah,
in the
I
city.
couldn't do it. Couldn't do it.
Yeah. I mean, it was beautiful for
Yeah.
so many other things.
Uh-huh.
So much learning, so much connection, so many people. My sister's there actually.
Yeah. Okay.
But I really did feel a calling out here, not only for nature, but like just the frame of mind that people have out here, the openness of people. People have been so kind, so friendly, so
Absolutely.
kind of welcoming since
Yeah.
I've gotten here. Everything just kind of feels right about
Absolutely.
it.
Cool.
The cost of living is a lot better, even though I know it's one of the most expensive cities actually in America right now.
Right,
But
right.
but it's still much less than
New York City. Yeah. Probably even Miami too. Miami's got to
Yeah.
be pretty high. So
Yeah. So yeah, all those reasons have
Okay.
drawn me to Denver, and it's been all those things
Yeah,
for me. Like
yeah.
it's been really helpful, and moving out here with my boyfriend actually was obviously also really helpful.
Yeah.
I mean, in regard to the intimacy part,
Yeah,
because
yeah.
I don't think I could have moved out here all alone.
Right.
Because it is very far from my
Yeah.
family, so I am going to be planning a lot of trips, kind of to
Cool.
visit and vice versa. So.
Yeah. So how did had you visited Denver in the past then, or like how did you? But so,
Yeah.
I mean, I understand the calling, but how did Denver get on your radar?
Yeah. I actually visited for the first time in 2012, I think
Oh, okay.
it was. But I mean, I thought it was beautiful, but I wasn't really ready for this kind of a
Yeah.
pace, I think. At the time, I was more like New York City
Right.
pace, Miami pace. But yeah, then I came out here maybe 5 times in the past few years for snowboarding trips.
Okay.
And then also in the summertime to kind of network a little bit before
Cool.
I moved out for business reasons. And every time I came, it just felt so right. And just the mountains, I'm really drawn to the mountains
Yeah.
now. I think the energy is just like, it's really vibing with me right now.
That's what I mean. I usually ask something in regards to this towards the end of all my podcasts with my guests, and it's like, you know, why did you move to Estes Park? Why Boulder? Why Denver? Why Colorado? And you know, we kind of go back and forth, and then I kind of always sum things up with like, there's just, I mean, I visited here as a kid. You know, different relatives here. My older half brother lives down in Colorado Springs, but until you actually move to Colorado, and especially like the Denver, Boulder, kind of this whole area, and then you get out to the mountains and stuff, there's just a different level of appreciation of like the people, the culture, the climate, everything once you actually move here. And I always say like, I can't really put anything into words except for there's just something like magical about it. You know, I think a lot, probably I've been to Southern California a lot, like San Diego, the ocean. Like there's just something unique and beautiful about being around the ocean. And you know, obviously like the mountains, the Rocky Mountains here, but Colorado is like, there's just something magical. Like
Yeah.
it's the people, it's the mountains, it's the sunshine, it's the snow, it's the, you know, what, there's a lot of factors, but it just goes back to like, I think it's just kind of something supernatural, and I think that's why the city is just blowing up, or the city of Denver, but then also like the state's just blowing up. All these people are coming here because there's something that's just supernatural, like that's magical. That's just it's hard to really explain.
Yeah.
Because I'm experiencing myself, like I have grown as a man, and like just feel like there's been so much awesomeness since I moved out here almost 2 years ago, and
Yeah.
you know there's a lot of factors that play into that, but again, it's just like Colorado's just a special, special place, and it's hard to put it into words. You know?
It is. I mean, we're the first city to pass the decriminalization of
Yeah,
psilocybin.
yeah.
I mean, something magical is definitely
That's a whole other
happening.
magical level, right?
I mean, it's
That's
definitely
a whole other podcast. That's like another 2-hour podcast or something. But yeah, no, it's very, I mean, definitely very progressive, open minded, and you know, it's cool. So, this is a question that I don't think I've ever asked another guest, but it's just something that I wrote down, and I want to ask you is what is the dream inside of your heart?
The dream inside of my heart.
Yeah.
I guess it depends on like day to day versus like really big picture.
Yeah, what big picture? Like what is like the dream, the vision that's just, you know, kind of like I've shared with you, kind of like the free range on the Front Range schools, kind of like that big dream that's in my heart. It's a big thing. It's like crazy, maybe crazy sounds crazy to some people, but that's what I'm chasing after. That's what I'm going after. Obviously, step by step, day by day, and all that. But that's kind of like the dream that's really burning inside of my heart or clear in my heart. So just kind of in that context of like kind of long term, like for you.
Yeah, I mean, honestly, just being able to help people every day, like being able to see people transform their lives, and like go from like not having hope and just thinking that this is going to be their situation for the rest of their lives, and like having that shift and seeing them kind of transform into such healthier people, happier people, like really getting the most out of their life. Like that's kind of what drives me, I think, to do what I do. But I think on a grander scale, I mean, I would love to be able to help more and more people in some way. I mean, it is kind of hard as like a solo practitioner. So I think, I mean, in terms of like Prime Health and where we might go, we might, you know, grow and just become like a center where there's...
You will grow. It's not might, you will. You will.
Yeah.
You will, absolutely.
We are growing, and we will continue to grow.
Absolutely.
And it will be really nice to be able to kind of reach people on a more grander scale. And I mean, if you want to go real idealistic on it, it'd be great to even do this on like a more political level, like in our country, and like, you know, have healthy food be available to people, and, you know, stop using toxins in our food, and you know, like help those kinds of things happen. You know, that would be really amazing. You're
gonna do it.
Yeah.
You know, and it's not just you, it's the team. It's gonna be,
for sure.
I mean, just like we were talking about, these people that are coming to Colorado and everything that's drawing these people to Colorado, like the like-minded people and the health and the fitness, like, you know, just as you take care of your business today, like there's going to be like-minded individuals, souls and minds that will come and be a part of your team. And yeah, you guys will do great things. Because I believe that, you know, that's the dream, that's the passion, that's the fire that's inside of you. And there's a lot of people that have that same passion, fire. Sure, you know what I mean? And this is a great place. Denver, Colorado is a great place to really foster that and fan that fire into flame. So that's cool. And it takes people, it just takes one or two people to say, hey, I'm tired of the way things are and I'm going to do something about it. And that impact that those one or two people have on the world and what they're trying to change, they might not see that in their lifetime. But by them stepping out, you know, fearlessly and boldly and going after what's inside of their heart, their dreams, their passions, their vision, all that, like that fire will catch on with other people. And it might be a generation, 2 generations. It might be 100, 200, 500 years after we're gone or you're gone. But if that's something that's inside of you, that's something that's inside of other people, and that change will happen eventually.
Absolutely.
I believe it.
Yeah,
so.
I believe it too.
Cool. Because that's part of like my vision and my big dream in my life is free range on the Front Range school. And I mentioned in that writing that I gave you, and when you have a chance to read it, part of it is the nutrition aspect of it. You know, 100% non-GMO. Farm to fork local farmers here in Colorado, because like I know that nutrition is the best medicine. You know what I mean? Food is the most powerful medicine on this earth, and for all the issues and everything that's going on with our educational system and kids, like we have to start at the micro level, and the micro level is, you know, what are we putting inside of our bodies? Yes. What are we feeding our kids? Like that's it. So like we got to start on the micro if we want to accomplish that macro, you know, and like kind of your whole thing with the healthcare and all that. It's like my whole thing is the education. Like the healthcare and the education in our country, they're both lack, you know, and they definitely need reform and all of that. So, you know, it's going to happen for you. It's going to happen for me because I believe in it. And you can't, you just, when people are passionate and people are set on fire, you can't stop them, you know. So, all right. So we it's like an hour and 19 minutes. So we gotta end it here. I want to be respectful of your time. So I just want to give you an opportunity to talk about what I said kind of in the beginning about you being a future cat mom. You kind of shared this with me before the podcast turned on, but what does that mean, you're going to be a future cat mom?
So, yeah, I'm really excited because I'm getting 2 kittens.
Okay.
They're specifically Bengal kittens.
Okay. Now what's that? I don't even know.
They're descendants of a leopard.
Oh, cool.
So they're the only cat that my boyfriend would allow me to get.
Okay.
I really would have been fine adopting a cat in a shelter,
right.
to be honest. You know, that's really what I would like to do. But unfortunately, these beautiful felines, you know, are not generally adoptable. You have to buy them from a breeder. But still, you know, I really do have like a place in my heart for cats and just like curling up to them. They're such majestic beings. And just being in their presence honestly makes me really happy, and for my own happiness, we've decided to get a couple kittens pretty soon.
So you're adopting them, and
I'm really excited about it.
Cool, that's awesome. No, that's good. And that's something. That's a whole nother. That could be another whole podcast. But like just like you hear about dogs, like they're a man's best friend. But and there's a lot of people with. I mean, even like in the city, that's another thing about Colorado. Like I'll walk into Natural Grocers and somebody will like have their dog, and it's not like a service dog, you know. So people are very open with the animals, and it's big out here, you know. But that's another thing with health is just I think it goes back to that connection. Obviously, animals aren't humans, but there's just something beautiful in regards to a human connecting with an animal on kind of that animal level, because we are at the end of the day humans are animals as well, you know.
For sure.
Cool. All right, so. We kind of the dream thing might be kind of in the same area, but the last question that I have for you, Soyona, is what sets your soul on fire? And if it's kind of the same thing in regards to what we talked about, just helping people, that's cool. But maybe if there's something else that you have to answer that, feel free. Whatever's in your heart.
Yeah, I mean, I would say that it pretty much is that that drives me is being able to share my light with others. Basically, share my knowledge, share what I've learned, and try to help people and watch their lives improve. And I see it all the time, and it's really what gets me going, and it's really what
sets your soul on fire, right?
Sets my soul on fire.
Yeah. So and this probably ties in a little bit with that, but on your personal Instagram, it says "Be light, lead with heart." What does that mean for you?
Yeah, I mean it means basically we all have a light within ourselves, and just recognizing that I think is step one, because some people haven't gotten there yet, unfortunately. But everyone has the ability to improve the world in some way or shape or form. So just recognizing that light within yourself and then sharing that with the world. I think that's really like our main purpose here. And then leading with heart, always, lead with love. If it's not love, then it's probably fear, and then that needs to be kind of addressed and looked at. So cool. That's kind of like my live by mantra.
Yeah, no, I love it. I saw that, I was like, I gotta write that down. And then it's so hard for me. I'm like, okay, this is the last question. I was like, oh no, I want to ask her that. And it's like, but we're already almost at an hour and a half, so we got to wrap it up. But cool. So Soyona, I just definitely want to thank you for your time today, taking time out of your Sunday to kind of share your story and explain kind of who you were and who you are and what you're all about. It's definitely gave us some insightful things, and it'll be definitely very powerful for the listener. So I thank you very much for your time.
Awesome. Thanks so much for having me.
For sure. So you kind of mentioned your website earlier. I just mentioned Instagram. If somebody wants to reach out to you and learn more about you and what you have going on here in Denver, how can they reach you? What's the best way?
Yeah, the best way would be our website.
Okay.
It's primehealthdenver.com. And we do have Instagram, primehealth_Denver. And we have a Facebook too. So
perfect.
Any of those places would be great.
Okay, cool. All right, so listeners, I just want to thank you once again for tuning into the 127 Fit podcast, hanging out with myself and Soyona today. I know that you guys gained great value from her story and her sharing her heart. If you guys want to reach out to me, you can reach out to me and find me on Instagram. It's at 127fitness. Facebook is at Quentin Vars. And then if you guys would just do me a huge favor and please like, subscribe, share, and then most importantly, leave a review for the podcast, that would be great. And if you think you would be an awesome guest, or if you have a friend or an acquaintance or a coworker or something of that nature you think would be an awesome guest for the podcast, please send me an email, and you can reach me at 127fit@gmail.com. Again, just shoot me an email, say whatever you're going to say, and we'll just kind of take it from there. And then if you are finding value, which I know you are from the podcast and the guests that I'm bringing on, the people that are sharing their powerful stories, I really want to kind of start a positive movement on Instagram. So if you guys would just start maybe sharing the episode that you're listening to, or the individual that you're finding value in through the 127 Fit podcast, just start sharing that on your Instagram stories, on Facebook stories. And then I just want to encourage you guys to start using the hashtag be someone to follow. That's kind of the tag for 127 Fit fitness and everything that we have going on, just to be that leader, be that example. So just start using hashtag be someone to follow. And then per the usual, I will leave you with Proverbs 24:10, which states, if you faint in the day of adversity, your strength is small. This time, until next time, I will catch you guys later.